personal opinion of hypertensive retinopathy associated with the preeclampsia is of the factor this disease is high blood pressure is the most damaging factor modified cardiovascular risk. Raising blood pressure increase the likelihood of cardiac and neurological disease and even death. And it's important to regularly measure blood pressure in the order to diagnostic hypertension and follow the appropriate treatment. Maintaining blood pressure levels within normal limits, we can avoid the damage. The hypertension occurs in different organs and in the eyes.
Hypertensive crisis is a sudden and severe increase in blood pressure. Dr. Frida Lewis Hall, the Chief Medical Officer of Pfizer, and I are going to explain why, if this happens, you need to act quickly.
A blood pressure reading of 180 or higher on the top, or 110 or higher on the bottom, is defined in medical terms as a hypertensive crisis.
It is particularly concerning if it's accompanied by symptoms such as chest pain, shortness of breath, numbness or weakness. People may also experience severe nosebleeds, a change in vision, or even confusion.
Hypertensive crisis can lead to life-threatening conditions like stroke. Can include loss of consciousness, memory loss, or eye damage.
If you are experiencing a hypertensive crisis and concerning symptoms, it's crucial that you seek medical attention immediately.
For more information, visit gethealthystayhealthy.com.
Women experience in early pregnancy. 6. Upper right belly pain, sometimes mistaken for indigestion or the flu. 7. Difficulty breathing, gasping, or panting. Having symptoms doesn't necessarily mean you have preeclampsia, but they are a cause for concern and require immediate medical evaluation. It is also important to know that some women with preeclampsia have no symptoms. The only way your doctor can diagnose it is by monitoring your blood pressure and protein in your urine, so keep up with all your prenatal appointments. Preeclampsia can also impact your long-term health. It's a risk factor for heart disease and stroke. Be sure to tell all your doctors, present and future, if you have a history of preeclampsia. Now that you know the symptoms, spread the word. Take the Preeclampsia Pledge. Know the symptoms, spread the word. Brought to you by the Preeclampsia Foundation. Learn more at www.preeclampsia.org 321-421-6957.
Preeclampsia usually affects women in the second half of their pregnancy. If it's left untreated, it can put both the mother and the baby's health at risk. It may lead to your baby being born prematurely, or your baby failing to grow as we would expect in the womb.
How would I know if I'm at risk of preeclampsia?
Early indications of preeclampsia are probably going to be picked up by your community midwife or your GP at an antenatal check. Women with preeclampsia have high blood pressure and protein in their urine.
Okay, let's do your blood pressure there.
They test your urine for protein and they check your blood pressure to make sure it isn't high. Sometimes preeclampsia can come on quite quickly and you might be the first person to notice the symptoms. In particular, swelling, especially in the face, the hands or in your ankles. You might have a really bad headache that just won't clear with normal painkillers. Your vision may be blurred, you may feel just really generally unwell. And in severe form, sometimes it can cause upper abdominal pain just under your rib cage on your right hand side. If you're not sure, go and see your midwife as soon as possible, or your GP, and let them check you out. Some women are more at risk of preeclampsia. So if you're overweight, have had kidney disease, diabetes, or suffer from high blood pressure naturally, this may put you at increased risk. If you are diagnosed as having preeclampsia, you will have a greater input in your antenatal care. You will have more appointments and your baby will be monitored more carefully. But if your condition becomes more severe, you will need to be cared for in hospital, and it may be advised that you have your baby earlier than expected, because delivering your baby sometimes is the only cure for controlling preeclampsia. There is evidence to suggest that taking low-dose aspirin or calcium supplements can reduce your risk of getting preeclampsia. However, it is advisable for you to see your midwife or your GP for any advice on any supplementation. So remember, if you feel unwell, you've got that headache that won't go away, any visual disturbances, flashing lights, swelling particularly in your face or your hands or your feet, go and see your midwife or your GP, get early treatment and keep you and your baby safe.
Hypertension caused by preeclampsia can adversely affect the fetus by causing constriction of the placental arteries. Arterial constriction may result in severe reduction in the blood flow to areas of the placenta. If the blood flow remains constricted, areas of the placenta may die, putting the baby in distress.